state your name. Say your last name slowly.
Przybojewski.
Okay, say it again.
So you just have to say Przybojewski.
Przybojewski.
And you put a P in the front and join it like Psha. Przybojewski.
Okay.
It just looks really bad. Like it's much easier.
It looks bad. It does.
Like it looks bad. If I tell people that, they're like, oh, that's not that bad. But if they try and say it, it's like almost impossible.
Okay. All right. Well, now.
But I mean, this country is like full of Eastern Europeans and stuff.
Oh anyway. Yeah, absolutely. Especially in Saskatchewan, we've got tons. Okay. So tell us how you got to Calgary to do IR.
It was never planned. So I was in South Africa. I quite enjoyed doing IR in South Africa. Like, I mean, not like, North America level IR, but it was like, yeah, it was, I sort of enjoyed it as a resident. And then when I became, staff, you call them consultants in South Africa. So when I became consultant radiologist, then one of my jobs was basically, working in theater most of the time. So I think my first year as a consultant radiologist, I must have spent about 7-8 months like just in theater. Wow. Like nonstop. So like that's probably where I enjoyed it as a resident, or we call them registrars. I enjoyed it as a registrar. And then also in South Africa, it's quite different. Like you start your senior call at like maybe end of your second year, PGY2. And then you would do senior call, and senior call could be obviously all the diagnostic stuff, but then it would be a bronchial artery embolization at 3 a.m. So you learned quickly like how to manage and cope.
Yeah, absolutely.
We did like a ton of bronchial artery embolizations, like a ton. And like if you phoned the consultant who was actually on call with you when you were a resident, you like got shit on. Like they don't want to hear from you.
Yeah.
So you were on your own. Then we did all the aortograms, because in those days you didn't have CT for arch injuries and stuff like that. So we ended up going to theater a lot when I was a resident. So then when I was as a consultant, I just spent maybe 6-7 months consolidating it. And so I enjoyed it. Anyway, then I wanted to get out of Cape Town and explore the world. And a girlfriend of mine who I studied with in medical school was living in Cranbrook in Canada. Do you know where that is?
I do. Yeah. Yeah.
So then she would come back and then she would show me like, because she's very well traveled and stuff. And then she would show me like pictures of Lake Louise and like all these beautiful mountains and skiing. I was like, man, I got to go there. Mm-hmm. So then I was like, well, hey, where do I start? How do I get a job? Like, just give me like an idea. And she was like, oh, by the way, there's a job in Cranbrook. Do you want to apply for it? I was like, okay. So, I don't know, it wasn't even that long ago. It was like, that would have been like 2006.
Okay.
So, I mean, internet was there, but I didn't even Google the place. I was like, yeah, it's Canada. Okay, I'm going. I just knew it was like, I thought it was like literally a 10-minute drive from Vancouver. And it was pretty wrong. I thought, I'm going to Vancouver. Yes. So anyway, I landed up getting this job in Cranbrook. And then I worked as a general rad for probably almost 2 years. And then I dabbled a little bit trying to like, do some IR,
right,
which you can imagine. And then I was like, no, and then the whole time while I was there, I was like, I want to do a fellowship. And I wasn't sure if it was going to be MSK or IR. Okay. Because I like both, and hence that's why I kind of do a little bit of both now. Mm-hmm. And then I applied for MSK fellowship and I got it in Ottawa, and then I applied for IR in Calgary. And then I still wasn't too sure. I was kind of like scared of the whole IR call, which in retrospect is better than being diagnostic, like you were joking the other day.
Yeah.
And so then I happened to be in Calgary for a weekend, because when Cranbrook you do that, you come visit the big city.
Yeah.
And I was literally in like flip-flops, shorts and a t-shirt, and I like phoned Jason Wong and I said, because I had applied, I said, hey, by the way, Jason, I'm in the city, and just turning this off, can I come say how's it, can I come say hi? And he was like, yeah, well, come for your interview. I'm like, I'm in flip-flops and a short and like shorts. He's like, that's fine. So I pitched up there and I met all the IRs, and I did my interview in like flip-flops and shorts. And then they gave me the job, and that's pretty much happened. And then I started working fellowship like mid-2009.
Okay.
And so my mind was kind of made up, because they offered me the job, and I was definitely tending towards IR for sure. I just needed someone to not reassure me, but just to try and tell me more about a life of an IR, which I didn't really have an understanding in Canada, because I'd obviously never done it. I would never even worked with IRs in Canada. So I think Jason and colleagues basically told me how it works, and it sounded very attractive. So I accepted the job, and that was it.
Yeah.
And then I stayed on after fellowship.
Yeah. And so I was going to say, did you have an intention of going back to Cranbrook or that area after fellowship? I guess it wasn't really IR there.
No, zero. Yeah. I mean, it's a small town. I've grown up in a big city in South Africa, and yeah, the small town was cool and fun and a different experience. But I know it was like time out. After 2 years, I was like, got to go.
Yeah, I've done
But then
it.
I was like, then they offered me a job at the end of my fellowship, and I was like, okay, well, it's definite because I like Calgary, and so it was actually really good.
Excellent.
But absolutely no plan. Like my trajectory wasn't planned in any way.
Oh, interesting. What's your favorite part of your job?
Are you talking about, yeah, so favorite part of my job, I just work with such an awesome crew. I think my colleagues are my favorite part of my job.
Cool.
Like I'm very, very lucky that way. And other favorite part of my job is that I just do so much. I do just all procedures all day, every day. Like I think I probably sit in a diagnostic seat maybe once a month, if that. It's either IR in the hospital, or it's like doing some pain interventions in our clinic and stuff. So like I'd say literally 99% of the time I'm doing procedures. Okay. So that's really why I love my job as well. And then I love the job because we do clinical stuff. Like, and I'm not slamming my diagnostic colleagues because they have a seriously important role, but like my worst day imaginable would be sitting in a chair on my ass reporting all day.
Yeah.
So yeah, I'm so glad that I don't have to do that. And I know it sounds kind of cliched and stuff, but I really do genuinely like helping patients. It actually feels good. And obviously outcomes are not always successful, but I think the majority are. And man, the patients just love you for it. So I like that part of the job. I think it's really rewarding. You get like feedback and on your procedures and your patients, you know, good or bad, but I think it's great.
That's great. So what diagnostic studies would you still read? Like mostly just arterial, like runoffs? Like
yeah, so I would exactly. So in an IR seat, we do all the CTAs and the MRs, and we also would read like the vascular malformation exams and that kind of stuff, all the vascular heavy stuff. Yeah. So yeah, we do that. Yeah, and then I obviously do a bit of MSK on the side as well, but it's not really related to my IR. But it is important because a lot of the stuff that I learned in the MSK clinic, like procedures using ultrasound guidance, various nerves and things like that, I've actually brought that from like the private clinic into the hospital setting, where I'll do lots of like nerve interventions for palliative patients and stuff.
Yeah, you did that amazing talk during CAIR. I remember that. That was quite memorable.
Oh yeah, so it's interesting that you've taken like what I've learned in the pain clinic for benign pain, I've kind of like brought that into the hospital. So it's been really cool that way, actually.
Have you had a chance to think about what your walk-up song would be to baseball?
So when you say walk-up song, is that like if I was a boxer and I'm walking to the rink and I want like it to be my motivational song and stuff like that?
Yeah, baseball players, when they walk to the mound, they're like, they have a special song that sings.
Oh, really?
Yeah. I learned this when I was in Toronto for fellowship and went to some Blue Jays games. Everyone's got like a walk-up song.
I get it.
But yes, boxing, same thing. What would be like your kind of fight song sort of thing? Or like in angio, if you need to get like
you will probably laugh at me because I don't think anyone will like my taste.
Okay.
Just 1 second. And there's a lot of F-bombs in these songs and stuff, so I don't think I can really.
Joel can bleep them out.
Oh, you're gonna like have a link to it?
Oh, no. I think we'll just play it and we'll see if he can bleep them out just here. Yeah. Are you gonna play it? Play it.
Maybe. Let me see.
Hey, play it on your phone.
Okay. Hang on. Wait.
Okay.
Or you could play this. You know this?
That's a good one. I like this.
It can be this.
Yeah, I like this.
Wait, stop. It's Notorious B.I.G. by Notorious.
Yes, okay, I like that one. That's a good one.
Okay.
Perfect.
Shiprasham, do you have any favorite IR procedures?
I like palliative, whatever, anything in the palliative realm, I really enjoy. and that can be a huge spectrum of stuff. I'm sure I'm known as the cryo person now because I always seem to talk about it, but I like cryo a lot. And not just cryo like for tumors, but there's cryo for nerve treatments, cryoneurolysis and stuff like that, which is quite a new emerging field in cryo. So anything related to cryo, and the fact that it's the possibilities right now for cryo are massive. It's not just what people think. There's a whole bunch of stuff on the side that's people are doing in various centers that I like, and I'm starting to do quite a bit myself. So I like cryo and anything palliative. And then obviously, I mean, who doesn't like vascular stuff? And I like tips, obviously. I enjoy that. Yeah. But if I think I had to choose like an umbrella, it would be palliative.
Okay.
Palliative IR.
Did you learn, like, did you kind of create that niche for yourself, or was there somebody doing a lot of IO or like palliative IO?
No, there wasn't. I think so it all started, I don't know, I guess you make relationships with doctors and stuff in the hospital, and they simply approached the palliative care service, which is obviously I learned is an entirely separate division, separate from radonc, separate from medoncs, and they asked me to do a grand rounds on some procedures. So I landed up doing grand rounds, and I can't even remember what I spoke about. It was quite a host of things, and at that stage it was quite a small repertoire of palliative procedures that we were all doing as a group, and I had a bit of interest in it. And from there, I mean, I think that I gave that grand rounds maybe 3-4 years ago, and from there it is absolutely mushroomed.
Wow.
And then I've just taught myself as I go.
Yeah.
I mean, we all have like a common skill set that you can apply to virtually anything. All you need is that skill set, which we all have, and then you just need to read a couple of articles.
Yeah. What gauge needle do you use for freezing?
So it's a 25 gauge needle.
Okay, same. All right. Is that pretty common across the board for you guys?
No, it is. It's that little orange one with that stupid protective.
Rip that off.
Rip that stupid thing off.
Yeah.
So it's that. I always actually thought that was a 27, but that's
that's a 25. Yeah, that little orange one. We have 3 IRs, and all 3 of us use different size freezing needles.
Seriously, what do they use?
So one of my partners uses a 27. There is a 27. It takes forever to freeze, but I do think the patients might appreciate it. And then another partner uses a 22. So,
oh, really?
Yes. Yeah.
So I have to disagree with a person that thinks a 27 is more comfortable than a 25.
Yeah.
I mean, really?
Yeah. It's hard. It's hard to know, exactly.
Are you that person?
No, I use a 25. Yeah,
okay.
I use a 25. That's what, that's the easiest. The 27 is one of those ones that comes out of like the little thing where you have to like get it out. I don't know, like it comes out of like.
Oh, that's like a dental syringe.
Yeah. So I just find it annoying to get it, constantly have to get it out. So.
I mean, I'm all for patient comfort. I just not sure it's going to make too much difference.
Yeah, exactly. Have you ever hitchhiked or picked up a hitchhiker?
I have not.
Good. Yeah, that's probably.
Have you?
No. Do you know what? No, I have. I picked up a hitchhiker once, and that was a mistake. Yeah, I don't know what I was doing. It was like raining, and I was young. I was like driving.
Sorry for them.
I felt sorry for them. I was like northern Saskatchewan. I was like driving to the lake, super rainy, and I like stopped and picked them up, and then I realized that was like I'm in my car, and it was like
you're by yourself.
Yeah, I was by myself.
Yeah, not clever.
No, it was very unclever.
So you must understand where I grew up. I grew up in South Africa.
Right.
So you sure as wouldn't pick anyone up.
Okay.
Like you just don't do that. Like that's like it's a gamble you just don't want to take.
Yeah. And where in South Africa did you grow up?
Cape Town.
In Cape Town. Oh, okay. Yeah. Did you do all your training in and around there?
Yeah, so there's 2 big universities in the city. They've always been rivals, obviously. So I did my medical school at the University of Cape Town, and then I did my radiology residency at the University of Tygerberg, which is the competitive, other very big university in the city. And then, and then obviously fellowship in Canada. So pretty much all my training in Cape Town.
And how old were you when you moved to Canada?
Like 32.
Okay. Did you have intention? Did you think you'd come for a bit of an adventure and then head back?
So the plan was to come here for 2 years and then and just have fun, earn some foreign income, get some foreign experience. And Cape Town felt very small, and I just wanted to escape and explore the world.
And so you went to Cranbrook.
Yeah. But like Cape Town's got like 3 million people in it.
Right. Yeah.
It's like this place is too small. I need to get out. Then I went to Cranbrook.
Yes.
It's like,
this will be better.
There's like 25,000 people. I was like, you got to be joking. So and then What was the question again? No, I've lost track.
If you thought you would go back. Yeah.
So then stayed here for 2 years, and then it was time to go home. And then my wife was like, well, we should probably stay and get passports. So it's a big South African thing. You get a foreign passport, so you have a plan B because the country's a little bit dodgy.
Right. Yeah.
And then you have a plan B. So I didn't want to actually stay. I was like, no, but I actually missed Cape Town. I want to go back now. I've had enough. And she was like, no, I think we should stay for passports. And then we stayed for passports. And of course, they tell you it takes 4 years to get what it took us. Then up like 7 years to get them. Right. So by that stage, I, had the IR job here, and it was like 7, 8 years. And then it was like, it just felt good. It felt right to stay.
Yeah, absolutely.
And I got to enjoy Calgary in the mountains, obviously, as well, because they're really close by.
Yeah, I was going to ask, what kind of things you do in your spare time if you've gotten into?
I really love skiing. I mean, I'm not like Canadian good, but I can get around.
Yeah.
Because I only started skiing when I was like 30 or 31 when I got here.
Yeah.
And then I did a lot of mountain bike riding as well, like in Cranbrook, and the mountains are just stunning.
Yeah.
I don't do that so much anymore. And then, I like to do some exercise and stuff, work out a bit. And then I also like, it's called a surf ski. It's a South African, it's like the way I describe it to Canadian is like a 22-foot, very slender, like sit on canoe.
Oh, okay.
So it's actually designed like they do races between the Hawaii Islands and stuff like that. It's actually an ocean going like vessel or whatever, or canoe.
Yeah.
And so I do that in Cape Town when I go back to visit, and then I have one here, and then I go to the reservoir here, Glenmore Reservoir, which is a pretty huge body of water. Wow. And I can go paddle for like an hour and a half, and it's like a really good workout. So it's like paddling basically.
Oh, neat.
So I like to do that in the summer, but winter I mostly ski.
Yeah, that's great.
And some hiking in the summer.
How did you get involved with CAIR? I have an idea.
Well, I mean, Jason's obviously been
Wong? Yeah.
What's that?
I said Jason Wong.
Yeah. So he's been involved in CAIR like from, I don't know, not from the inception, but for a long time. And then obviously when I was a fellow, I would have gone to the CAIR meeting there. And then, I guess, I've spoken a few times at the meeting. And I guess maybe my involvement in that Jeopardy thing maybe got me more involved in CAIR, and ever since then, just helped out with some talks and stuff. And then Jason left the board, and then when you leave the board, you have to volunteer or recommend people.
Right.
Yeah. So obviously I got sucker punched.
Yes.
And Jason recommended me, and then you have to be vetted and stuff. So I guess that's how. Yeah. I mean, I've only obviously just been appointed, but I think I've pretty much gone to, almost every meeting since I've been in Canada. I went back to South Africa for like a little 2-year hiatus, but I think I even flew out to one of the CAIR meetings when I was in South Africa. Yeah. So I've been to pretty much all the meetings. And then obviously I'm also quite involved in the M&M meeting in February.
Yes.
I'm on the planning committee for that. So I've been on that committee for like 3-4 years now as well. So I guess that's also how I got involved.
Other than those grand slams and catastrophes in the mountains, where has been your favorite CAIR meeting, like city that you've gotten to explore?
Montreal, without a doubt. I love Montreal. Yeah, I've had some really cool meetings there. Yeah, it's been we usually have quite a rip when we go there.
Yes, it is.
I was a bit quiet now this last meeting because I was jet lagged. I just flown in from South Africa, so I was like feeling a little bit sorry for myself. But normally we're like out till 3 a.m. You know what it's like.
Well, and I think I was so happy. It was such a fun conference. It was a wonderful conference, but it was still kind of one of the first in-person conferences since the pandemic. And I still think there was a little bit of apprehension.
I do think so.
Maybe a little bit, which is good.
Yeah.
But I think it was like a little bit less of that, like just go out and like.
I think next year, because next year will be Montreal again, I think.
Quebec City. I think.
That's right.
Yeah, so that'll be good.
That's going to be awesome. I've never been and I want to go. So
I've been once in high school, but I've heard nothing but good things about Quebec City. So I'm excited for that too. Is there a city in Canada where that you haven't seen a CAIR meeting where you would like to see a CAIR meeting?
So, I mean, it would have to, so again, excuse my obviously my geography of Canada is not great. Has CAIR been in Halifax? Has it been in Halifax?
You know what? If it has, it hasn't been there in a long time. And
because I would like to go to a Halifax meeting. That would be my, because I want to go to Halifax. I heard it's a really nice, very cool town. Yeah. And so I think it's been there once before, but again, that would have been before my time, I think.
I think so too.
So I would love to go to Halifax.
Yeah.
Or one of those cities out east somewhere. That would be very cool.
Yeah. Yeah.
Yeah, something like St. John's or something like that. Yeah, just because it would be very different and cool.
Yeah, I agree. That's cool. We ask a lot of the people we interview this. Do you do G-tube insertions, like percutaneous gastroscopy insertions?
Yeah.
How long do you wait after you put in a fresh G-tube? How long do you wait to feed a patient?
So we stratify them, and I'm still not entirely sure why we do that. We stratify them into low risk and high risk.
Okay.
I assume if the procedure was a bit dodgy and maybe a couple of punctures too many or whatever, we call it a high risk, and then it's 48 hours.
Okay.
Yeah. And then we say feed slowly, watch, for peritonism and pain, blah, blah, blah. So it's like a feed slowly. So it's a 48 hours with like, certain conditions.
Okay.
And if it's like a low risk, simple procedure, was like, man, that was like super easy. It was great. Then it's a low risk, and then it's 24 hours. Okay. Yeah. What do you guys do?
We do 4 hours for our standard. We do like
before they can be fed.
Yeah. We start.
I mean, but that's interesting because I just did. You probably heard about. I don't know if Tara presented this time or whether you were at CAIR before, a transesophageal G-tube.
Oh yeah, I've seen a case of that before. Yeah,
so I did
not
one.
Me, like I've seen somebody present it. Yeah.
Yeah. So I did one 3 weeks ago.
Okay.
And I was like, man, when do I feed this patient? Like, do I wait 48 hours? Like it's got to heal and stuff. Yeah. And Tara was like, no, I think, what was it? She said like 24 hours.
Yeah.
And
yeah. Well, in fellowship, again, we use the balloon retention feeding tubes, and I usually use 2 T fasteners as well. Right. So in fellowship, we use the old school, tubes.
Wog.
Yeah, exactly. Yeah. Well, no, we use just the loop retention tube, and we didn't use any T fasteners.
Oh, that's a WOG, the loop retention. Yeah.
Yeah. The loop retention tube. And then they discontinued those, and we would do 24 hours. But then when I got back to Saskatoon, we were doing once we started using T fasteners, we're like, well, let's see about 4 hours.
Okay.
And we feed slow. It's been, again, if it's a sketchy insertion, then I longer, but G-tubes are some of the most, not frightening, but I know exactly
what you mean, because a G-tube either goes perfectly or south. There's nothing in between.
No, exactly. And exactly. So
it's one of those things that if you start talking about G-tubes at a conference, you will have massive disagreement and massive debate about how many T fasteners and how long do you wait to feed, and so it's a very controversial.
And we also we put the NG down the night before, people have to, and they get barium the night before, so that the barium in the colon, which we didn't do in fellowship. That was a local thing that we have discussed, and people were very adamant, so that by the next morning the barium's in the colon, so you can see it. Which is nice, you just sort of trusted. You'd look if there was a CT, you just sort of trust that it wasn't there. You'd push this, you inflate the stomach and push it away. But there's so many different ways to.
We would give barium if, for example, we bring the patient down and there's a lot of gas here.
What the hell?
Can't see too well. Let's try again tomorrow. Give some barium. Then we would do it. But even in that circumstance, I mean, I've probably done that once or twice in over a decade.
Yeah.
So I mean, I mean, the bottom line is there's many ways to.
I know there isn't a lot for the barium, because I did a big lit search when we were discussing it, and there wasn't a lot of but there was just so much history of doing that in our center, and really the question was well, why would we stop? If maybe if it helps 1 in 1,000 people, why would you stop using it? Other than they have to wait an extra day with an NG tube and all that stuff, right? And
many ways to skin a cat.
There are so many. I mean,
there's many right ways to do it. You know what
I mean? Do you have any mentors in IR that we'd want to name?
Honestly, I know it sounds again a kind of cliche, but I mean, I have awesome mentors in my practice. I mean, and I always have. When I joined, Robin Gray was there, and he'd been doing IR for 35 years. Then there was Benny So, also 30 years. Dave Sadler, I also see him as a big mentor. He's a surgeon as well as an IR, so he's got a really good clinical perspective. He's got such a good head on his shoulder about should we do something or should we just leave it alone? So I'm surrounded by them. John Larrigan's an engineer and an IR. So he is just, if I can't figure out like something just doesn't stick or fit or there's incompatibility, like he'll just have the answer. Like, so yeah. And then I obviously have Jason and Eric as well. And they're very clued up, sharp guys. So I think my mentors are many.
Yeah.
Interestingly, I've kind of used Peter Monk. I don't know if you know Peter Monk in Vancouver.
Yeah, I don't know him, but obviously I know of him. Yeah.
He's mentored me growing the cryo practice. I used to show him quite a lot of my cases in the beginning. So he was a bit of a mentor as well. So yeah, I actually don't have one in particular, but certainly I'm blessed with many.
Do you have any advice for junior staff or for trainees?
Don't rush, take your time. You know, I'm not a firm believer in see one, do one. Like for me, I'm like C10, do one. Yeah. Like I'm one of those people. Like, and I also like reading like an animal. I always tell, like, IR is, people think it's just a technical kind of like, it's not. There's a lot of like theory and stuff. So I always tell the fellows and the residents, you must read like an animal. Like just read a lot so that you get like a really rounded kind of thing. So yeah, read like an animal and C10, do one.
I like that. That's good advice. Yeah. What was your last publication?
Oh yeah. So the funny thing is I've actually got several on the go right now. Okay. My last official publication, I think was a splenic embo paper. And that was actually quite a while back. That must have been like in, I'm embarrassed to say, like 2012 or something. But I'm hopefully about to publish a paper on desmoid cryo.
Oh, awesome.
I have actually been part of quite a few. I was just like a hanger on because I did the procedures. I'm a couple of adrenal venous sampling papers, which really I didn't do much on at all. I just was like involved.
Okay.
So I'm on that, and we have a few projects on the go right now with like palliative ablation and of like bone metastases and stuff like that. So I think we'll probably have a couple coming up, but I haven't been really big on the publication front. I have quite a few projects on the go, probably too many right now.
Right. Yeah, it's hard to keep that balance. Do you have a go-to karaoke song?
Has to be Sweet Child of Mine.
Oh, okay. Hey, that's a good one. Yeah,
it has to be that.
All right. I feel like at the next CAIR meeting, we'll have to try and do a karaoke night.
Oh my God.
Yeah.
Everyone has to have, so what you have is you have your venue, and as you walk through the door, there's like a row of shooters, and you just get people to hit those, and then you're good.
Yes, exactly. Oh yeah, no, it won't be sober karaoke. That's
my God.
Can you imagine? lights on, sober.
Horrendous. The worst.
That would be terrible.
No, very dark and a couple too many drinks.
Yes, absolutely.
Yeah.
I think that's most of my questions that I have for you.
I feel like I haven't given you much, but anyway.
No, you've absolutely given me lots. No, it's good. It's kind of just like a
get to know you.
But yeah, it's a puff piece, if you will.
Yeah. So you and Joel now they're like the co-editors for the what do you call that thing? The Express.
CAIR Express. It's the newsletter. Okay. Yeah, it's not academic. It's just like.
But have you been doing that for a while?
No, like a year and a half.
Yeah, because I feel like we used to get more of those CAIR Expresses.
Well, we're maybe a little bit delinquent on our next issue. Yeah. It's like 4 times a year. We're supposed to get them 4 times a year.
Okay. That's quite a lot though.
It is. I would say it is. And it's hard to come up with like interesting things that people want.
It is quite a lot. It is a lot.
Cool. All right. Well, thank you, I think.
Yeah.
Between two probes.